So down here in the Tri-County area, the populations here, we have trouble accessing primary care. South Carolina is a state that did not expand Medicaid, so therefore those patients fall in the gap and they don't have access to services. So that's what the population and the issue that we have here. And also those patients that are out in the rural area, they have trouble accessing care even more. Okay, so a patient may go to the emergency room for primary care, and that's just because they don't know about the resources that they have in their local community. So here at AccessHealth, we serve as that hub and that gap for that patient to just ensure that they do have someplace to go when they're sick instead of utilizing the emergency room. So for instance, if we have a patient that utilizes the emergency room, we'll help connect them to like a primary care provider that's in their community because we know that transportation is a barrier. So we try to make sure we place that patient in an area that's conducive for them. And so when we look at the patient holistically, that patient may have food insecurities, they may have issues getting their medication, and so we help connect them to other community resources. So what it means to the community is that they have somewhere where they can go and access services. So it's also like a security blanket for the patient because they know that we will stand in the gap. We will make sure that they have access to their medication. We make sure that they have their like SNAP benefits if they qualify, or we make sure we connect them to family planning checkup, which means that they can get certain screenings yearly that's conducive to their health as well.
So one of the programs that we offer here at AccessHealth is our National Diabetes program. And with 1 out of 3 individuals walking around not knowing they are pre-diabetic, it's really imperative at this point in time that we prevent the diabetes epidemic that we're experiencing here in the U.S. And so with individuals that are participants of our program, they receive a year of lifestyle coaching, individual coaching. They are provided an environment where they can collaborate with other individuals that are also trying to prevent type 2 diabetes. This ultimately is going to reduce the impact that it has on a global scale of our healthcare system.
The goal of our program here at AccessHealth is continuing to save lives and making a difference. It's a wonderful program, and it just touches so many lives here in our community.